Hey guys, so today we're answering questions, true or false, regarding breast implants.
Implants need to be replaced every 10 years.
False. Implants do not need to be replaced every 10 years. I tell my patients every 5 years we should get a high resolution ultrasound to look at the integrity of the implant shell. As long as every 5 years you're up to date with that, then you never have to remove a perfectly good implant.
Fat can be used for volume instead of implants.
True, fat transfer can be used to enhance breast volume. There are limitations to fat, which the implants don't have those same limitations, but always need to be seen in person to evaluate if you're a good candidate for that, depending on what your goals and desires are in terms of breast size.
Incision placement affects implant position.
False. Placement of the incision has really no bearing on the position of the implant within the pocket. The most important part of the shape of the breast with an implant in place is the pocket that's created. Typically, we place the incision right in the inframammary crease, so right in the breast crease. That is the workhorse for breast surgery, because if you ever need a revision, then we have to go back through that same scar. So you'd rather have one scar that you can use multiple times. But with that being said, really the most important part of this is creating the appropriate pocket for the width of that particular implant.
Implants can help with significant sagging.
False. A breast implant by itself is not going to correct all your problems related to breast sagging. If you need a lift, then you need a lift. Now, there's different types of lift scars, which we can talk about later, but ultimately, if you need a breast lift, it's always worth the scars, because if you place an implant in the hopes that you're trying to elevate the nipple, you will be extremely dissatisfied. And in fact, in many cases, it'll look worse than if you didn't do anything at all.